How do I use a roto-rooter in urologic surgery? Let's talk about TURP, T-U-R-P. Hey guys, Dr. Segel here. So the question is, coring out my prostate like an apple, why would I need a TURP, TURP? This is one of the oldest surgeries that we've done in urology. I think one of the first things that we have to try to figure out is need versus want. And at the end, I'm going to tell you about the one way we can figure out pretty darn reliably whether it's going to help you or not. So make sure you stay tuned to the end so you can get that pearl of wisdom. So need versus want, right? So I think that, so let's draw a prostate in here. The prostate will sit something like that there. Shade it in so it's easier to see. As men get older, their prostates get bigger. I think a lot of people understand that. When the prostate gets bigger, I've used this analogy a number of times in these videos. We're like plumbers. So this prostate's getting bigger. This urine's collecting in the bladder. The urine can't get out. And if you talk to a 67-year-old guy, you ask him how they pee, they say, well, doc, not like when I was 25. And that's because their prostate's getting bigger and bigger and bigger with time. So one of the first things that they notice is that their stream is impaired. And some people, it's very, very bothersome. They stand in front of the toilet. They're standing there for minutes. It's driving them bananas. They go, and then they feel like they didn't get everything out. They come back, they go again, and it's ruling their life. We've tried medications on them. They're not cutting the mustard. And so these are people that probably want a procedure done on their prostate to generate a better stream. And we'll talk about later, opening up this prostate can also significantly help with symptoms of urgency, frequency, feeling like you got to run to the bathroom. So if people have been on medications for their prostate for an extended amount of time, medications for their bladder for an extended amount of time, and they're just not working out, then they'll say they really want this TURP procedure. So that's want, okay? Then there's the need category, right? And this is kind of a medical necessity. And I would say the majority of TURP procedures that we do are for this need category. When urine is collecting in the bladder here, a lot of times it doesn't bother people. We may see that there's extra urine left over in the bladder, and the patient says, Doc, I could care less. And so we leave them well enough alone. But what can happen over time, and this is a real problem, is these tubes up here, one right here and right here, these are ureters. These are tubes that carry urine from the kidney down into the bladder. And again, to use the plumber analogy, if there is too much urine in the bladder, well, guess what? It's going to back up into those ureters. It's going to back up to your kidneys. That's a big problem, okay? I've seen countless cases of kidney failure because urine has backed up into the kidneys because of a very enlarged prostate that's causing impaired bladder emptying. So I think it's super important if you have symptoms to talk to your PCP, talk to your urologist, do a scan on your bladder, make sure you're emptying okay. That is a need category. That is somebody that needs, in a lot of circumstances, a TURP procedure because we need to get them medically better. We need to get their kidneys functioning better. We need better urine drainage from the upper urinary tract. Another kind of need reason for a TURP is if urine's not getting out of the bladder effectively, it gets infected typically over time because bacteria will invariably get into the bladder and it's not getting out of the body quickly enough, and so it'll get infected. So people with recurrent urinary tract infections over and over and over again that just don't seem to go away or are happening all the time and ruling their life, that is another need category for why we might want to open up the prostate with a TURP procedure to get them to empty more effectively and get that infected urine out. So that's the second one. The third one is if urine is stuck in this bladder because of the really big prostate and medications aren't cutting the mustard to get the urine out, well, guess what? This urine can create stones because when it stays there for a while, it'll crystallize. And so people with recurrent bladder stone formation will need a TURP procedure to get that urine out more effectively so their urine's less likely to crystallize within the bladder itself. So that's another reason why we strongly consider TURP in the need category of bladder stones. So bladder stones, incomplete emptying that's certainly causing kidney damage, urinary tract infection. These are all need categories for the TURP procedure. So there are certainly patients that we do it because they want the procedure done for quality of life reasons, but then there's a need category. So hopefully that kind of gives you some insight as to one versus the other. People ask me, well, how are you going to do it? And the technology for TURP has really progressed over the last 20 years. When I was training, we learned the old-fashioned technique where you ran something like glycine or sorbitol into the urinary tract. You open this up with a typical cutting loop that you use in regular surgery. And we've progressed since then in terms of the technology for reducing the size of the prostate. Then came along the laser technology to laser vaporize the prostate, almost like caramelizes it. It's pretty neat to see. And people still do that, and people are very good at it. Oftentimes now we're doing opening up procedures with electrovaporization, so a bipolar technique. We can use a number of different instruments through the urethra to vaporize the prostate or shave out the prostate with less side effects as the old TURP technique. And people ask me, well, which one should I choose? And I don't think it necessarily matters a whole lot. Conventional TURP is done few and far between now, but there are some urologists with more gray hairs than me that are excellent at doing it. And if that's a technique that they feel comfortable with, then I think it's a fine thing to consider. But I think the most important thing is that the urologist that you're seeing feels comfortable with that technology. So if they say they do it a certain way and you like the urologist and you think that they're good, I would just kind of strongly consider their technique rather than try to ask them to do a technique that they don't do as often. So that's what I would say about which technique to choose. I think it's a joint conversation you need to have with your urologist and talk about what they do most of. I think it's super important. People ask about the recovery. I would say, a long time ago, these patients always stayed overnight in the hospital. And now the majority of patients that I do this procedure on go home. Now, it depends on the findings intraoperatively, make sure that there's not any significant bleeding, no signs of infection, etc. But in general, the majority of them will go home. Now, you go home with a catheter for a variety of reasons. We leave a catheter in the bladder going to the outside world because one of the biggest reasons why is because that catheter puts pressure right here on the prostate. And when it puts pressure on the prostate that we've shaved out, it decreases the bleeding afterwards. So it's like kind of a pressure balloon on there to decrease the chance of bleeding afterwards. And also, oftentimes when we open up the prostate, if you didn't have retention of urine, you may have it afterwards. So this catheter carries urine from the bladder to the outside world until your bladder kind of regains its strength after a few days, and then we take the catheter out. Sometimes we'll take a catheter out the day after surgery. Sometimes it wait a couple of days. It just depends on how big the prostate is, how much work we had to do in there, and you can talk to your urologist about that. Well, the next question is, what are the drawbacks? Certainly bleeding, infection are drawbacks. Makes it so you don't have an ejaculate. You get either no ejaculate or retrograde ejaculation. That's because we're cutting through the ejaculatory ducts, so it doesn't necessarily affect anything with your orgasm, but it makes it so you don't have an ejaculate, to be clear. There have been some studies that have suggested erectile dysfunction, problems with erections. I think that's pretty few and far between, but it's worth mentioning because some studies have suggested that. It is truly a no-incision technique to accomplish our goal, and I think that's remarkable because there's not a lot of procedures in all of surgery, whether it's urologic surgery or elsewhere, that are truly a no-incision technique, but this is. One thing that I think is important for people that kind of fall into the want category, they want this surgery to improve their quality of life, is to counsel them about the overactive bladder type symptoms and what their expectations should be afterwards. When we open up this prostate and we get the catheter out, typically guys will say, oh my gosh, I'm peeing like I'm 20, 30 years younger, and they're thrilled with that. But a lot of guys wanted it not just because they wanted to get a better stream, but because their bladder is overactive, so their bladder will squeeze. When a bladder squeezes, it makes you feel like you got to run to the bathroom, urgency, frequency, etc. When we open up the prostate, those symptoms, those overactive bladder symptoms of urgency and frequency, don't immediately get better, because let's say you're 65 and we do this procedure, your bladder has been pushing against a prostate that's been big, sometimes for 20 years. So it's used to pushing really, really hard. It's got to get retrained. It's got to get reacquainted with the size of your prostate, which is now much smaller. And that remodeling, that the bladder figuring out that it doesn't have to squeeze quite as often and as frequently will sometimes take months. So what I mean to say is that the strength of the stream will oftentimes improve pretty darn quickly for patients, but the urgency frequency symptoms can sometimes get worse before they get better. And the time course where they will get better sometimes is in the time frame of months, to be clear. So that should be kind of one of your expectations afterwards. So I don't want you to feel distressed if afterwards you feel like your stream's stronger, but your urgency and frequency are worse. I would say just give it some time in regard to that. And this is my pearl of wisdom, because one of the most common questions people ask us when they're thinking about doing it is, Doc, is it going to work for me? How do I know if it's going to work for me? Okay. And sometimes if they fall into the need category, I tell them, I don't know whether it's going to work for you, but I think that the benefit outweighs the risk, because we're trying to get you medically better. But in the want category, people that want the TURP, there is one test that we can do, and this is my pearl of wisdom. It's called a urodynamics test. It's a test where we put a catheter in the bladder, we fill the bladder up, and we see how well it squeezes. We see how strong of a contraction you can generate, so that we know that if we open up your prostate, your bladder will be able to push against it, because sometimes bladders just stop working. It tests that. It tests your degree of overactive bladder, and it tests whether you're truly obstructed or not. So if the urologist talks to you about the technique and you want to do it, but you want some type of information, some more information as to whether this is likely to help you, you can inquire about a urodynamics study. It's not vital to do beforehand. I would say oftentimes we do it, and in cases where we're not sure if it's going to help somebody, we will almost certainly do it. But that is the one test, and that's my pearl of wisdom for what you can ask for, what you can discuss with your urologist to have a more rational idea as to whether this is going to help you or not. So guys, thank you so much for listening. I hope that gives you some insight as to how we use a Roto-Rooter in urologic surgery, the details of TURP, the ways that we do it. Thank you so much for listening. Like I said, please subscribe to our channel. Please look at all the playlists here. I think that it'll give you some valuable information. Thank you very much again.